The Burkitt Center has two pillars. One pillar is biomimetic dentistry, and that is the new way and new techniques, new materials of bonding to teeth really strong so that you're less likely to ever lose the teeth. That's one pillar, biomimetics. But today, what I want to talk about is something called biological dentistry. What is that? It means that we understand that traditional dentistry, the way it's been done for dozens of years, can affect your immune system. And a part of biological dentistry that I want to focus on today is about diseased bone. So what we're looking at here and what we're going to look at throughout all of this are strictly from my patients. These are all the x-rays that have been x-rayed in my office at the Burkitt Center. And I want to show you what healthy bone looks like when you have a tooth removed. So this is the patient's lower right area. And if you're not used to looking at CT scans, then this might be a little confusing. But this patient has tooth number 30 removed, their lower right first molar, and they have had quite a bit of bone removed here over time, or it just has resorbed over time, I should say. So they've lost a decent amount of bone from here to here. But what I want to focus on is the quality of the bone that you see right here. All of this spiderwebby looking stuff where it's black but also gray. I can't absolutely verify that there's nothing here that's bad, but to me it looks really, really good. It has, whenever the patient got this tooth removed, I don't know if they got a bone graft or not, but when they had this tooth removed, this bone has healed into good quality bone, okay? Now, up here, this patient on their upper right, they've got a bridge, and you see this big dark circle here, all right here? So this is not good. That is an abscess. And if you showed this CT scan to the vast majority of dentists that know how to look at a CT scan, they're gonna tell you that this tooth is dead and it has abscessed. So we know that there can be diseased bone around a tooth. But what dentists struggle with, because we haven't been taught in dental school, what dentists struggle with is to admit that once you take this tooth out, the diseased bone can stay there and your body does not automatically heal that. That is called a cavitation. There's many different terms for it, but this is an area that if we don't actively remove this hole here, all of this, if this infected bone is not also removed, your body very well may have a very difficult time clearing it out over time, okay? So that's nothing crazy from an idea of the tooth, having an infection, but the question is it true that if you pull the tooth out and don't clean it out really well, that area can stay in your bone and cause immune issues over time? Well, we'll figure out the immune stuff later. We'll talk about that later. Right now, I just want to show you actual cases from my own patients that show you when the tooth has been removed, that either it was not cleaned out well or some diseased bone was left around the edges and it led to bigger issues. So here's an example of another patient who came in, and now this is the patient's lower left. And this little area that you see right here, that is the root tip that was left. So this person's top of their tooth that they chew with has been completely disintegrated, and the root tip has come out of the bone and is just kind of dangling in the wind, and there's a ton of infection in this person's jawbone, all here, okay? All of that is infection. The tooth hasn't really been removed yet, so yes, there's infection. And so sometimes that infection shows up on an x-ray as dark because the destruction of the bone has led to this like fatty tissue that's just completely disintegrated into like whatever you can imagine, bacteria, fungus, mold, even microscopic parasites. Yes. And yes, that dark stuff that's on an x-ray, when you scoop it out and you put it into a microscope and you look at it, it can be all sorts of crazy material. Now, sometimes when you have a tooth removed, your body does not respond by having an infection there. It responds by walling everything off and turning it into what's called sclerotic bone. And you can see all this white stuff here. So this person has had a ton of sclerotic bone to wall off the infection. And now if you placed an implant right here, there's no way that it would survive because there's no blood flow. It's all diseased bone, all of it. So if we wanted to place a dental implant there, we need to go in and remove all of this bone, which is an absolute ton of infected, diseased bone that's not going to help us. So sometimes your body responds by having a diseased process that is a very dark area that we have to send off to pathology. And other times it responds by creating dense bone to wall off the infection, and that's what you see here. So now this is another patient of ours. She came in interested in biological dentistry, and what we're seeing is where the tooth was. Remember, what are we talking about here? Can there be diseased bone that's left over once the patient gets a tooth removed? The answer is yes. We've already shown x-rays from our patients where they had the tooth there and they had the diseased bone underneath the tooth, and we term that to be called an abscess. Once the tooth is removed, we're taught in dental school that the bone will just naturally heal. It's just not true. And in the dental community, for some reason, unfortunately, since we're not taught, it's not the dentist's fault. They're trying to do what's best for their patients, I promise you. The problem is that we're not taught this in dental school yet. So what you're looking at here is a patient's lower right area where you can even see this patient has an infection on this root canal tooth on the front side of it. And they also have what seems to be an infection on the back side of it that could very well be associated with this root canal. But look at where their wisdom tooth used to be. Their wisdom tooth used to be right here. And you can see that that's also very dark. So the last thing that we want to do is leave that dark area in that patient's jawbone because it can elicit disease in other areas of our jawbone. We'll talk about the immune response later. So now I'm going to pull up a scan of a patient who's had his teeth gone for a very long time. Because you think, okay, I understand that there can be disease under a dead tooth. But if the tooth has been gone for a very long time, is it possible that there is disease in the jawbone that lasts a long time? Let's take a look at this patient's lower right jaw. Look at that. All of that darkness there is massive infection. That's huge. How big is that? Let's see. That means this person's jawbone for roughly what, 18 millimeters? 18 millimeters across, there's just a massive hole in it. There's no telling what type of disease process is going on in his jawbone. And he's had his teeth removed for a long time. Now, there is something in the middle here that I'm not sure what's going on. Maybe this is a little bit of leftover tooth, and that's helping elicit this process. In any case, when a tooth is extracted, and here's my point, when a tooth is extracted incorrectly, or when a tooth is extracted with only traditional methods of dentistry, it leads to this type of diseased jawbone. What I'm doing right now is I'm going backwards and forwards towards the tongue and away from the tongue, and you can see how diseased this person's process is. It's crazy. This is very, very diseased. And so our goal with biological dentistry is to admit and understand how dentistry affects the immune system. And if we do dentistry, especially oral surgery, only in the traditional way, then it's very possible that we leave diseased process behind, whether it is the really dense bone that we showed, or whether it is the very non-dense bone, hyposclerotic bone, where it's just this mushy stuff where it could be parasites, fungus, mold, bacteria, anything, and even Lyme disease. Lyme disease is very much found in this disease process because there's no blood flow. The infection is preventing blood flow from getting there, which is why you can't simply take antibiotics and have this clear out. So I hope this is helpful in helping patients understand what biological dentistry is. One big part of biological dentistry is to make sure that we are doing correct oral surgery, really good biological oral surgery. We will post some articles and research articles that point to this from Dr. Sharam Gennady as well. And man, this is the most exciting thing about dentistry for us, because we understand that we are truly helping our patients in a much higher way, because we are making sure that we are removing infection that could be affecting them systemically. And we're also helping our patients lead healthier lives. And that's something that is very difficult to find nowadays with the way that our food is, and our water and our air quality and all the things. It just makes it to where finding a dentist who understands biological oral surgery and understands cavitations and understands diseased jawbone, it is more important now than ever.